I'm going to introduce you now to Grant Laidlaw, who's a fellow employee of the Scottish Government, and he is in the he's a strategic policy manager in preventative and proactive care. But most importantly, he's one of the people who are shaping this new initiative called GIRFE, Getting It Right for Everyone. So he's going to talk a little bit about where we're up to so far, and what his aspirations are for what this is going to do for service delivery. So, Grant.
Thank you. Just before I start, this presentation is quite a comprehensive presentation, so I will be skipping over a few of the slides that go into more detail, given we've only got around 10 minutes or so. But the slides will be shared afterwards, and my contact details are there, and I'm very happy to discuss further with anybody following today's conference. So, GIRFE, Getting It Right for Everyone. It's a proposed multi-agency approach of support and services from young adulthood to end-of-life care. So essentially, we've got GIRFE, which is Getting It Right for Every Child. GIRFE is going to be the adult version that will take over from the GIRFE age group. And it really is focused on individualised support and access to services and planning and support around services. And I think that the last bullet there really summarises what GIRFE is in a bit more detail. So it's really about providing a more personalised way to access help and support when it's needed, and it places the person right at the centre of all the decision making that affects them to achieve the best outcomes for them. So we're talking about person-centred outcomes, using a joined up, coherent and consistent multi-agency approach regardless of the support that's needed. So it's all about the support that's needed at the time that it's needed. And I think I'm very relieved, having listened to all of today's presentations. I think what we're talking about here is entirely consistent with everything we've heard today. So I'm going to talk a little bit about the plan going forward around GIRFE, and a bit more around the co-design approach that we're adopting with it. And I'll outline some of the timescales we're working to, which are quite ambitious. So GIRFE really places the person right at the centre. So we're moving the centre of gravity from being siloed and siloed service provision. Services are really, really good at doing what they do. They produce wonderful metrics to demonstrate they're achieving objectives, they're delivering their service. What they don't really tend to do is focus on what does that mean for the individual that are accessing these services. So our ambition is we're going to move the person to the centre of that. So we're talking about me and mine. So it's the person, their values, their wishes, their care or support needs, all taken into account, and looking at how is that provided in a coherent and collaborative manner. So the green circle round there, and this is just an example. It's not an expansive example. This is just one particular example that has been used previously. So we're talking about the principal care team there in the centre. And that's likely to be involved with all patients, and that's your sort of typical multidisciplinary team or multi-agency team in the GIRFE perspective. And then moving out a bit, we've got additional services like dietetics, LD, audiology, etc., in this enhanced MDT, community-based services that can wrap around and provide support as it's required. And then finally, on the outside circle, we've got the access to specialist services, which could also include emergency care, etc. The strategic context of GIRFE, I think the really important thing is here, GIRFE is not a new concept. So we're building on existing adult best practice and also GIRFE as well. And we're looking to develop a national practice model that is going to embed interagency working. So it's not replacing the framework for community health and social care integrated services, but it's the model to deliver it and support person-centred outcomes. I'll not spend too long talking about our governance. It's a bit boring, but I think the important thing is we have established a GIRFE steering group that sits within the Preventative and Proactive Care programme. The GIRFE steering group has a quad leadership, so we've got a quadrumvirate, so 4 chair people, and they represent primary care, AHP, social work and nursing as well. So right from the outset we're establishing that this is a collaborative approach, and we've got representation on that group from medical directors, nursing directors, executive leadership. We're bringing in chief officers. So we've got a real cross-section, and I think very importantly we're bringing in lived experience representation onto this steering group as well, and the importance of that can't be underestimated, and I'll talk a bit more about that in detail shortly. We've established 5 principles for GIRFE, and these are pretty much aligned to the GIRFE principles. And I should say these principles are written in pencil at the moment. We're about to go through a co-design process, and the principles may be tweaked and changed a little bit, but I'll run through what they are just now and what that really means to how we're going to deliver this programme going forward. So firstly, we're talking about individual care needs, so we have to ensure that every person is empowered and involved in multidisciplinary or multi-agency decision making around the support that's available to them and the support that they want to access. And it covers physical and mental well-being in their current situation, in people's current situation. And so I think really we're taking this holistic approach to ensure that individual needs are really taken into account and appropriate supports provided as it's required. Early interventions are a really key part of this. So we're aiming to ensure that individual needs are identified and appropriate supports provided as early as possible, and we expect the outcome from that is that we will then reduce need for crisis intervention, etc. People's needs are better understood and the care can be provided at an earlier stage. And I think the interesting thing that's been covered at a few of the presentations today is around stigma and people not willing to access services or not able to access services. So I think this approach is going to give them the support to be able to access services and when it's needed, and break down some of these barriers that we have in our existing system. To achieve all of this, we have to have joined up information sharing and working. And this is probably the fundamental change that we're looking to implement within GIRFE. It's the biggest challenge we've got. At first sight, it might look like an infrastructural change that is required, and it is. We need infrastructural change to allow organisations to work collaboratively, to share information, to address some of the information governance challenges that we've got, data protection challenges. But I think alongside that, there's a huge challenge around cultural issues. So a lot of this work could be done within the existing systems if we can change some of the cultures that to enable people to work together and actually be willing to work together, because there is a lot of evidence that services aren't communicating effectively around the patient or the person, and they will be referred to multiple services. So we're trying to avoid that, and this is the fundamental part of GIRFE, is to break down those cultural barriers and provide an environment where people can work together. GIRFE is underpinned by human rights, so it's got a human rights approach, and it's ensuring that the standards and principles of human rights cut through all of the policy making as well as the day-to-day running of the organisations involved in the care provision. So we're now at a stage where we're starting to realise GIRFE. I think we've been developing the GIRFE product over the last 10 months or so, and we're now at a point where we're about to implement PATHFINDERS to actually test some of this, and we're going to do this on a national basis, and I'll talk a little bit more about the detail of how that's going to work, but we're looking at setting up local areas with the practitioners and the people involved. The people who access care and support will be central to designing how these services are going to look, and we're going to have a design school support model to help teams and people come together and give them a safe space to understand what the problems are, what needs to be done, and then what is actually possible in the current environment, and then how do we do it? How do we produce a model that provides services in a different manner? And as we do that, we'll be developing a learning network to share the practice that's coming out of that, and I'll talk about timescales as we come to the end of the presentation. So we've established we're going to have 5 place-based pathfinders, and they're aligned to 5 themes. So the 5 themes are people in prisons, people in addiction services, older people in frailty, families with multiple and or complex needs, and that includes the young people progressing out of GIRFE into GIRFE environments, and people registered at deep end GP practices. So what we'll be doing is writing out to all health and social care partnerships this week looking for expressions of interest to establish pathfinders along these themes. Now, it might be that some areas will have one pathfinder theme, we might have other areas that have all 5, but I think central to this is it could be one person is affected by all of these pathfinder themes. So we know that the deep end GP practices, that's going to be Glasgow area as we progress that, but the other ones we've had expressions of interest already, just informally from various different parts of Scotland, including remote and rural areas. So there's a real interest in doing something around GIRFE. And we'll be taking a co-design approach, which is going to look and feel very different to how we normally design services. So central to that, we're going to have people who access the services are going to be supported with the workforce and management and leadership to understand what actually needs to change and why does it need to change. And we'll be using data and evidence sources to try and support that process and giving people a safe space to really drill down into what's working, what's really not working, and what do we need to change. I think the interesting part of this is we've started pulling in some of the user research that we've been working on, and already it's quite clear that there's a pretty significant difference to how services think they are being delivered, and I use services in a broad manner, compared to what the user experience is feeding back to us. So that services are thinking that they're achieving their objectives, they're delivering the services in a meaningful way to people who are accessing services. The first bit of research we've had back is around the older people's journey map, and that clearly shows there is a huge gulf in terms of what's actually happening to users, service users, and what people think is being provided and how people access services. So it's going to be quite an interesting piece of work to take this forward to understand how do we bring these two groups together to actually understand what's the better way to provide these services. And then as part of that co-design process, we will then be looking at idea generation of how do we do it differently, and then what do we need to test, and agreeing the decisions that will come out of that, and what are the person-centred outcomes we're trying to measure here. And that's important because, as I've alluded to, we're delivering services really well, but we're not actually delivering person-centred outcomes too well in a lot of areas, and in the majority of areas we're not measuring person-centred outcomes meaningfully. So it's going to help us redefine how do we deliver services, how do we measure impact of services. So just to cover that again, in terms of the co-design process, we're going to have lived experience involved in that. We'll have delivery partners, and we'll have various stakeholder organisations, and that will include third sector, etc. The co-design approach, we've established we're going to have 4 co-design days in each of the Pathfinder areas. So there'll be the discovery day, defining what the problem is, important insights that have come out of the research, and then developing the ideas that can solve the problems that we've identified, and then delivering the ideas and how do we take forward this new model. And I think it's, from my perspective, I come from an NHS background, acute service management background, and I was one of those people that could say, well, I know what the problems are and I know what the solutions are, but we're very conscious that we don't. We're actually trying to take a big step back from this and getting all the partners into the room, focus on lived experience as the centre of this, and really understanding from the user perspective, what does this mean? What do we actually, should we be providing? What is it people actually want, and how do we provide it? So we're needing to put a lot of our assumptions aside, and I'm sure a lot of the assumptions will be correct, but we're quite aware that coming out of that, there's going to be a lot of new things that we haven't actually built into our services. I think in terms of where we're seeing the benefits to establishing the regional or the locality-based pathfinders is it's going to give areas the opportunity to engage with Scottish Government and actually influence policy in a really meaningful way. And it will give us an opportunity to understand what are the enablers and the barriers that we need to address to make this work. And I've mentioned it before, but things like information governance, data protection, etc. These are all going to be likely barriers, and we need to understand what can we do to remove some of these barriers. and that will be progressed through the Pathfinder development process. There'll be ongoing structured support for all of the Pathfinder areas, and we'll have drop-in support sessions online that we can provide expertise to unpick some of the challenging problems that we might come across. And as I said before, we're going to develop a GIRFE learning network to invite people to join that, to learn from experiences of other areas and best practice. And I think I should say at this point, we're aware that there's pockets of really good GIRFE practice going on all over Scotland in different services, different areas. So it's not new, but it's about how do we take what works in one area and learn from that and share it across. And we're not going to have a one-size-fits-all model, but we will have a lot of learning to understand this is how we could apply that concept or this model in this area to benefit people who are using services and accessing services. In terms of milestones, as I said before, we've got a very, very compressed timescale. We were looking at years to try and actually do the design stage. We're now into years to implement this because we've been under pressure to deliver. So this week we're writing out to all the health and social care partnerships, looking for expressions of interest to develop pathfinders. We've had informal discussion with some of the chief officers. We've spoken with chief social work officers, etc. We've done quite a bit of engagement, and so far the feedback and the buy-in to this has been very, very positive. And I think that's important because what we're looking to do is really change culture of how we work, change the culture of how we work and how we work together and collaboratively. And without that senior leadership buy-in, it's not going to work. So we've definitely got senior leadership buy-in. So we're writing out to them to look for the expressions of interest, and we're looking to, by the end of November, we'll have identified the Pathfinder areas that we're going to take forward. We've got a set criteria that we're going to apply to how we assess them and take those areas forward. We'll go through the co-design approach up until April, and then the Pathfinder areas will be going live with their GIRFE tests from April onwards. And then the intention is that by summer 2025, this model will be implemented across Scotland. And that sounds very ambitious. It is very ambitious. It's unlikely to be implemented across the whole of Scotland, but that at the moment is the target that we're aiming for, is to have GIRFE across the bulk of Scotland and delivering meaningful outcomes for people. So that's a very quick summary of GIRFE, and this presentation will be shared following today's session. But as I said earlier, I'd be very happy to engage with anybody after the session. My email address and contact details are there. I'd be really look forward to any discussion going forward about how we can work together and be involved in this exciting piece of work. So thank you.